ky/workforce.
Good afternoon, and thank you for joining us for today's coronavirus press briefing. I'm Caroline James, in for Donna Bush. Welcome to our viewers on CIGTV, YouTube, Facebook, and our listeners on Radio Cayman. Today's prayer comes to us from Reverend Audley Scott.
Heavenly Father, you are the all-knowing and the all-caring God. And you understand we all face trouble and difficulty in some point in our lives. And these are difficult times for all of us. Father, thank you for keeping us safe from this virus thus far. And Heavenly Father, we thank you for the privilege of approaching your throne of grace. And as I do, I pray for the leaders of our land. I pray for His Excellency the Governor, the Honorable Premier, and members of the Cabinet and the opposition. Give them the understanding, dear God, and the clarity of thought and wisdom. We pray also for the Medical Office of Health and all the frontline workers and the laboratory staff. Father God, I pray you will enlighten your people of this island, that they will understand all that is being done is for our own good. And I pray, God, as a people, protect us from this coronavirus. Heavenly Father, you are the great physician. And I pray today for the total eradication of COVID-19 from these Cayman Islands and from the world as a whole. Again, Heavenly Father, I join with others in this country in praying for your protection during this hurricane season. Keep us safe. Keep us under the shadow of your love and your mercy. And it is in the name of Jesus Christ, your Son, our Savior and Lord, that I pray. Amen.
We welcome our panel today, His Excellency the Governor, the Honourable Premier, and the Honourable Minister for Health. We're also joined by the Honourable Minister for Commerce, Planning and Infrastructure. In the room with us are the Chief Medical Officer and the Director of Hazard Management, along with our sign language interpreter, Ms. Carolyn Powell. Welcome also to members of the media who join us via Zoom, along with the Medical Officer of Health. So we invite Dr. Lee to deliver his update, first of all.
Good afternoon, everyone. There are 451 negative results to report today and no positives. That brings the total number of tests down to 21,282. So our total positive for the islands since this began remains at 195, with 3 in Cayman Brac. No people are symptomatic at this time. There are 40 asymptomatic people. There are no people admitted to hospital at this time, and 154 people have recovered. There are 140 people in government isolation facilities and 166 being isolated at their home. In the previous day, 6 people attended the flu clinic with mild flu-like symptoms, and there were 20 calls to the flu hotline, with 7 being flu-related. Thank you.
Thank you, Dr. Lee. And members of the media have any questions for you. First, we have one from the public. We're only a couple of days, obviously, into level 2, but people are wondering if you have any observations or concerns so far.
I think that the fact that we've been testing all the while and the testing results are pretty much consistent, if not showing an improving trend, And one of the graphs that I have has shown a downward trending line, which is really good, even though the mean value for positives hasn't shifted much. I'm really encouraged by that. And we all clearly hope and we anticipate that that will continue, which is great news for the islands.
It's very reassuring. Kayla Young from the Cayman Compass, I believe you have a question for Dr. Lee.
Hi, Dr. Lee.
Good afternoon.
As we relax the shelter-in-place measures, do you anticipate that we might start seeing more positive numbers pop up? And if we do, would that be normal and expected or a point of concern?
I'm not anticipating a rise in the numbers. That's why we've spent all this time being locked down, in that we hope that what we're seeing at the moment is the tail ends of people's infections when we find positive people. We don't believe that we're finding people with de novo new infections on board. We're rather at the tail end of their current, of a previous infection.
Great. And the public has noticed that you're looking fresh today. You got a new haircut. Any recommendations on where to get a good cut?
I don't think you really want my answer to that.
Oh,
But
that's
yes,
all
I was
for
very
me
pleased.
today.
I was very pleased to return to my barber, and I think he was actually quite happy to see me too. So it's good to meet up again.
Yes, I think the barbers are eager to get people back in those chairs. Those are all my questions for today, Doctor.
Thank you.
Thanks, Kayla. Wendy at the Cayman News Service, go ahead.
Thanks, Caroline. I just have one quick question for Dr. Lee. Dr. Lee, can you remember the last time you reported a positive case of a contact? So rather than in one, although picked up by screening, rather than being just a random person, a positive test of someone that was connected to another positive test. Can you remember how long ago that was?
The short answer is no. The short answer is no, Wendy. I would hazard a guess. It's around 2 weeks ago or so. I mean, every few results I have been reporting a contact to somebody that's known to be positive, but whether they actually got the disease from that person, it could actually be that the contact was the person that originally had the disease and not the other way around. You have to imagine.
Yeah.
But also, if they're all at the tail end, it could be that that whole household was at the tail end, which is why we're really looking forward to the immunoglobulin studies. I do have some advance information about that, and as I've mentioned to you, we're going to report those more as blocks rather than on a daily basis. But the immunoglobulin, the antibody testings that have so far been reported, and the reports have started to come in, are showing very low levels of antibody positivity.
Okay.
And in people often that we know were positives, and not in people beyond that group. So interesting in some ways.
Does that tell you about something about the strain of the virus then?
It's not telling me anything at the minute, because we really need to look at the results in more detail.
Okay. I look forward to getting those results. Thanks, Dr. Lee.
Thank you.
Thank you, Wendy. Thank you, Dr. Lee. We'll turn to the panel and to the Honourable Premier.
Thank you very much, Caroline. Hello, everyone. Results are continuing to trend incredibly well, and that gives us all a great deal of encouragement that the strategy that we've employed thus far is working. And there's a great feeling, I think, all around of optimism. Moving to suppression level 2, the first phase of that, also means a lot more people are back in the workforce this week, including helpers and caregivers, hair and beauty salons reopening, churches, cinemas, and theaters all able to open, providing strict social distancing measures are in place. So far, the reports I've received have been encouraging as businesses begin to fully operate. So as we continue to move forward, I ask you all to remain vigilant. It's no longer about stay home Cayman, it's about stay safe Cayman now as we ease restrictions. We all have done a great job so far, and at great sacrifice. The virus hasn't entirely gone away. It is still here among us, and that's why we need to maintain our social distance, always wear a mask or cloth face covering in public places, and adhere to respiratory protocols. I have to say that I went for my first haircut in God knows how long today, and I was pleased. Pleased is not strong enough, really. I was really impressed at the measures that the salon has gone to ensure safety. Everybody wearing visors, all of the technicians wearing visors, and all customers wearing masks, and lots of sanitizers around the place. So I think everybody's taking it, that I've seen, taking this issue very seriously. We will continue with our plan of aggressively testing and will carefully monitor results as more people come back into the workforce and gather socially. But as I said, the results so far are very encouraging. Industry-specific guidance is shared on the government website. The guidance has been developed to support the safe reopening of a number of areas coming online and includes guidance on babysitting for parents and primary caregivers, welcoming your child caregiver back into your home, guidance for the operations of early child care centers and summer camps, vacation Bible schools, which will come online on 5th July. And there's also a framework for restarting sports, contact sports, on the 19th of July. So take a moment and go on to the site and pick up what information you need. Guidance for the reopening of churches has received support from both the Cayman Ministers Association as well as the Conference of Seventh-day Adventist Churches, and is also available on the government webpage. For the removal of doubt, we keep getting questions about this. It is important to note that those attending church are still required to wear masks indoors. Please continue to check the website www.explore.gov.ky/coronavirus for information. And stay safe, Cayman. I have another announcement which I think many people will welcome. As we continue to open up and as more of our people overseas are looking to return home, we have decided to utilize the individuals, I should say the team, who worked with what was known as curfew time to migrate into a new body that we will call travel time. Based on the success with which curfew time helped our COVID-19 mitigation, the new travel time operation will be run by Chief Officer Eric Bush from the Ministry of International Trade and his team. Travel time will be tasked with coordinating the return of Caymanians, permanent residents, and work permit holders to the Cayman Islands. In doing this, they will also manage the government isolation facilities to ensure that there are sufficient rooms for those returning and who need to isolate as required. They will also work to coordinate the repatriation of those looking to return to their homeland. It is expected that travel time will assume full responsibility of this operation from the 1st of July. All arrangements and announcements made to date for travel to and from the Cayman Islands will remain the same. Since March 22nd, when we closed our borders, the government has arranged 30 emergency repatriation flights, which have enabled our own people to return home and expats to return to their homes amidst global travel restrictions. These flights, organized through the National Emergency Operations Center and the Governor's Office, Cayman Airways, as well as the Cayman Islands Government Office in the UK, required a huge amount of coordination. In the Cayman context, the flights were further supported by extensive and highly admirable work by civil servants and volunteers to create isolation centers and manage all of the logistics required to support the government's aggressive measures to stop the spread of the virus. As NEOC is winding down, the entities and individuals that have coordinated emergency travel are returning to their normal work operations. For the next few months, while we still have restrictions, travel will require streamlined coordination between a number of government ministries statutory authorities, as well as other countries via His Excellency the Governor and his office. As I've mentioned, in order to create a streamlined experience for individuals who need to travel to or from these islands, we have authorized the creation of a new entity which will coordinate these efforts. The new entity, called Travel Time, will manage and organize travel and liaise with the public. Through all of our combined efforts over the past 3 months, we have managed to keep COVID-19 from getting out of control in our country. And we are doing incredibly well, but we must not rest on our laurels. The new Travel Time operation will enable government to better facilitate travel to and from our shores while continuing to successfully manage the COVID-19 risk and indeed keeping us from jeopardizing our hard-earned success.
Thank you, Premier. Your Excellency.
Yes, good afternoon. Thank you very much. So yeah, that is very encouraging on the test results. That's 2 days now, almost 1,000 results and no positives. So again, I reiterate what the Premier has said. We really are in an incredibly positive position on our islands. I wanted today just to refer a little bit to World Health Organization, because I was very struck yesterday by their press conference in which they announced that this pandemic is still accelerating globally. And on 21st of June, there were 183,000 new cases, which was the highest in a single day so far. And we're at 9 million cases worldwide, and 500,000 people have very sadly lost their lives globally. I also think it's worth underlining that there's no evidence that the WHO tell us that that less potent strains of the virus are emerging. So nothing has emerged to suggest that a decline in communicability or impact of the infection in recent months. And I say all that simply to underline again that we do need to keep on our guard, and we do need to get into the very good habits of social distancing, basic hygiene, good respiratory practices, including coughing and sneezing and how we do that, and wearing masks in public. This remains the best way to protect ourselves and our family and community. And as we look to open the borders safely, trade-offs will be necessary, and there is no zero-risk solution. So we do all have to be disciplined and in this new normal until a vaccine is developed. And I do think it's important just to underline that message. Secondly, today, I want to announce that the UK Security Assessment Team that's been with us for over 2 months now will be leaving at the end of next week, at the end of their mission here. I'm very grateful to them for all their assistance, because they've done some really good work behind the scenes in a number of different areas. They helped coordinate the visits of RFA Argus, including the hurricane exercises and the helicopter support that was provided to RCIPS. And the ship's helicopters provided support to Cayman in a number of ways, including directly involved in a drug shipment detection. And they also, at the weekend, were able to help to rescue 2 kayakers who got into difficulty. The team have also provided logistical support to the HSA laboratory to help manage the difficult task of ensuring essential supplies of COVID testing materials. And they've worked with us at the airport, coordinating the BA Airbridge flights. And they've also been really helpful in the recruitment and plans for the training and legislation needed to develop the Cayman Islands Defence Regiment. They helped run a workshop to review emergency incident command system that we use in Cayman, and we're taking away some recommendations from that. And they also took part in a cross-overseas territory conference to review hurricane preparedness in light of the COVID pandemic, and have worked really closely with Danny Coleman and her team in hazard management. So I think bringing this team in with the full agreement of the Premier was at a challenging time, was a very prudent and sensible thing to do, and a signal of the UK's commitment to Cayman. And once again, I'm grateful to the team for all that they have done for us. And then finally, the Deputy Governor has asked me to announce that new, more convenient ways for customers to submit and pay for services are being introduced today. Again, this is a part of the civil service's strong focus on doing even more to improve customer service. So starting today, applicants for British Overseas Territory citizenship, naturalisation and registration, and British registration, the expungement of criminal records, can submit applications via email. Customers will also be able to pay fees for these services at post offices, and fees can be collected at the airport, West Bay, Savannah post offices, and payments can be accepted in US dollars, Cayman Islands cash, debit cards, credit cards, and local checks. So I won't give any more detail on that today. A press release is coming out, but just to say that, again, this is a really important innovation to improve the customer service standards across our islands, and I very much welcome it. And thank you to Mary Rodriguez and Jodie Whitaker in the Deputy Governor's Office and Postmaster General Ms. Sheena Glasgow for all her work on that. Thank you.
Thank you. Minister Seymour, we'll turn to you for your update, please.
Thank you, Caroline. Good afternoon, everyone. This is in Grand Cayman, Cayman Brac, and Little Cayman, and our Caymanian diaspora listening. No local lives lost is something that we are proud of, and to that I say thank you to the people of this country. We could not do this without you. It was the most people I've seen on the road exercising, whether walking or running or riding. It looks so beautiful to see our people on the road and doing something, exercising, but it looks like you've slowed down now since we started to open up. Let's keep it up. Most stayed home and some put on some weight. What's a little weight when you have life? Let's start that exercising again. Did you know exercise improves your mental health, your mood, your sleep? You eat better, you think better, get more energy and better memory. Let's get back out and let's get started exercising again. Today's scripture reading comes from Isaiah 25:1. Lord, you are my God. I will exalt you and praise your name. For in perfect faithfulness you have done wonderful things, things planned long ago. May the Lord add a blessing to the reading of his holy word. Shout outs today go to one that I missed, Your Excellency, Governor Roper, for staying in the trenches with us. As I've said before, we appreciate all you and your team has done. Thank you again, publicly. I want to say happy birthday to Miko Ireland Moxham Watson, 10 years old. Happy birthday to you. Also want to give a shout out to the Parks Unit dealing with the sargassum, or what we call it, seaweed at times. We thank you, especially in the areas of South Sound Dock, Spotch Beach, and Coalwood Beach. Thank you for all the work you're doing there. Also want to give a shout out to Doctors Hospital for taking on 4 young Caymanians on their employ through Ms. Jean Solomon. The contact was made and they took them on to specifically deal with the testing. So I thank you very much for that. And also thank you, Ms. Jean, for the basket that was delivered here for the panel. Also wanted to say a big thank you to Major Projects Office and Public Works through Minister Hugh and Ms. Leda, Tristan, Peter Ranger, Nyasha Brady, Charles Brown, and all the crew that are still working on the projects even through COVID-19. They're still working on projects such as the mental health facility in East End, John Gray High School, the Bordentown Primary New Hall, the Bordentown Coalwood Beach Public Dock, Bright Court Park off Condor, Frenchman's Breakers Park, and also the project with the Bordentown Church of God Hurricane Shelter. Still working on the Prospect Park and the walking track. And Garvin Park Dock and Ramp, the ISWIMS Base Management Project, the West Bay Police Station, the Heroes Park upgrade, and the list goes on with over 40 projects. They gave us a presentation yesterday, and I was really proud of the team. I thank you all very much. We thank you for all that you do to help improve the lives of our people in this country. We're a blessed country, and let's thank God for his many blessings upon us. As you're aware, Cayman has moved into level 2, minimal suppression of the COVID-19 response. And as many of you have heard, the Health Services Authority has begun to initiate its phase plan for the reopening of elective surgeries and outpatient care. In this phase, people who require non-emergent and minor care can now access the Cayman Islands Hospital, all outpatient clinics, including the district health centers, Faith Hospital in Cayman Brac, and the Little Cayman Clinic. HSA understands that because of the closures to many of these services during the pandemic, there is a patient demand for medical, surgical, and procedural care, and I can assure you that the HSA staff are carefully and appropriately prepared to meet this demand. There will be a phasing of all services across the HSA facilities over the time with a focus of stringent measures to protect patients and staff from COVID-19 based on the established guiding principles. All patients with a previous appointment will be contacted to reschedule. If patients have questions or concerns about missed appointments or need to make an appointment, please call 949-8600. Public Health will also launch a vaccination campaign over the coming weeks, providing an opportunity for patients to receive any missed immunizations. There are a list of safeguarding measures which include pre-registration of all patients prior to their appointment to minimize lines and congestions, pre-screenings of all patients for temperature and COVID-19 symptoms before they enter the clinics or departments, changes to waiting room seating in all clinics to maintain social distance of at least 6 feet, dedicated clinic days for the elderly and immunocompromised patients only. Clinics and diagnostic services will be arranged such that adequate social distancing between patients is maintained, including additional outdoor space to expand waiting areas, expansion of telemedicine services. Medical records can now be obtained at the information desk in the hospital atrium. COVID-19 screening will be required for all patients being admitted for elective procedures, include the elective C-sections, 3 business days prior to their procedure, and will be directed to the designated screening areas. There are further steps, including PPE for all staff and daily screenings of their employees, as well as careful logistics to ensure social distancing. For a full list of other measures, I would encourage you to please visit the HSA website. We know many of you are also hopeful to hear that you can start visiting loved ones as well. I'm pleased to tell you that the HSA will take all necessary steps to gradually ease current visitor restrictions, but only under guidance from the public health to prevent the spread of the disease and protect patients, staff, and visitors. There is a visitation policy which must be adhered to, which they have made public. However, there are still some questions. I'm happy to go over them with you all now. Visitors must be 18 years old and wear a face mask at all times. All visitors must be screened prior to entering the Cayman Islands Hospital. All visitors are asked to sanitize their hands upon entering and exiting both patients' room and the hospital. Visiting hours are from 11 a.m. to 8 p.m. for medical, surgical, and critical care units. Inpatients who require assistance may have only one caregiver as part of their care team. One visitor will be permitted to accompany a patient to facility care or treatment such as ambulatory visit, procedure, or same-day surgery. One visitor per day will be permitted in the maternity ward. 2 persons, parent, guardian, or caregiver for patients on the pediatric unit. Neonatal intensive care unit allows for 1 parent daily. COVID-19 positive patients will not be allowed visitors. We know it's a lot to remember, so please also rest assured that the HSA team is working on many reopening items, including signage, which will help us all navigate the changes safely. As your Minister for Health, I'm so pleased to let you know that you can safely go to the hospital again. Our hospitals regularly manage infectious diseases and have put additional measures in place to ensure patient safety during this time. It would be remiss of me not to echo the sentiments of my team at the HSA to remind patients and visitors that we are still living in a worldwide pandemic and to continue to really drive home the message that we must all take necessary precautions to protect ourselves. For more information and services of the clinic, department hours, please visit www.hsa.ky or call 949-8600. Today, I also wanted to include a shout out to Nelson Dilbert and Walker Romanica, Cayman Distillery, for their ongoing supply of free hand sanitizer to the HSA over the past 3 months. They have donated over 5,000 liters of sanitizer. The donations have gone to various entities and authorities island-wide in Grand Cayman, as well as some 55-gallon drums, which have gone to Cayman Brac. The donations have gone out to, but are not limited to, the following entities: the HSA, the RCIP, Department of Environment, CBC and Port Authority, HMCI and Isolation Hotels, Northward Prison, Judicial Administration, various doctors' offices and private clinics, charities including Meals on Wheels, Humane Society, Cancer Society, One Dog at a Time, and various others, countless medics, officers, frontline workers, and individuals, Protocol Office and the Legislative Assembly for the recent sessions. Thank you guys for playing such a great part in the fight against COVID-19. Additionally, I know many of you are concerned about the Sahara dust plume that is spreading across the Caribbean. I wanted to take a moment to remind the public of the statement issued by the National Weather Service saying that we can expect hazy conditions across the Cayman Islands over the next 24 hours. Due to this, Public Health Department is advising the public that these conditions could increase symptoms in persons with asthma and other respiratory illness due to the elevated dust and particle matter concentrations. Such persons are advised to stay inside as much as possible at this time. For additional weather information, please visit www.weather.gov.ky. For any health concerns, please call your doctor or public health at 244-2621. Finally, there have been numerous reports of an upsurge in mosquitoes across the island. The MRC are aware and working hard to combat these. Aerial sprayings occurred last night across the north side and Prospect Red Bay areas and will continue again tonight across Frank Sound and the north side areas. Ground spraying continues as well in the Whitehall Estates, Snug Harbor, Smith Road, Walkers Road, North Sound Estates, and Bordentown areas tonight. We are experiencing more mosquitoes currently due to the above average tides and recent rainfall. Thankfully, these are not disease-carrying mosquitoes, but annoying, unfortunately. I want to ensure the public that MRCU has been surveying and treating the product sites and emergent flying and biting mosquitoes throughout the COVID-19 pandemic. They have done so whilst, and most importantly, ensuring that personnel and staff adhere to all the proper precautions related to risks of COVID-19 transmission. They have tried not to allow COVID-19 to impact their service, but it has been influenced and impacted operations to some extent. In the past 2 weeks, the aerial program has serviced all 3 islands whilst working closely to the airport and airport operations. Operations that are also impacted by COVID-19 are doing what they can to ensure safety in the workplace. Aerial and ground operations both have been impacted by high winds this month that sometimes made spray operations impossible. Despite this, and in spite of COVID-19, personnel of the MRCU have been working in the field since mid-March to survey and control mosquitoes. They will continue to do so diligently until the current mosquito population return to a normal level. In closing, I say thank God and pray for the continued merciful protection of the islands and remind the community to please continue practicing social distancing, wash your hands, wear your mask, and keep yourselves and your kids at home if you're sick. God bless.
Thank you, Minister. We'll invite now Minister Hugh, the Minister for Commerce, Planning and Infrastructure, to deliver his update.
Caroline, if you don't mind, before the Minister starts, I'd like to wish happy birthday to Captain Eldon Colonel, who's 94 today. Happy birthday, Captain Eldon.
Birthday.
You can stay there. I'll do it from here. I'll do it from here, Minister. Yeah, man.
Minister Hugh, thank you.
Thank you, and good afternoon, everyone. I was worried that His Excellency the Governor and the Honourable Minister were not going to leave anything for me to say today. But I do have one or two things up my sleeve. Obviously, they didn't hear about it, so. But anyway, good afternoon, everyone, and it's certainly a pleasure to be with you this afternoon and to have an opportunity to share with you some exciting news and a bit of update on some of the works that my ministry have been engaged in over the last few weeks since the last time I was here. We certainly have been doing business. It may not have been business as usual, but we continue to operate as a ministry. Only a few of our services have reduced or stopped as a result of COVID-19, and those services were in-person services which we have been unable to transition to an online platform. Things such as written and driving tests for DVDL and some of the front counter service within government administration building. As the government moves forward with further easing of the restrictions, I want to reassure members of the public that we are in the process of implementing plans to return to full service delivery in a safe way, both for our employees and the customers that we serve. Before I provide the updates on some of my departments and agencies, I'd like to announce what I would consider an exciting new initiative across the 3 Cayman Islands, which has been born from a very successful private and public partnership. 10 community Wi-Fi hotspots are now available across Grand Cayman, Cayman Brac, and Little Cayman for the enjoyment of our residents and for free public access. Having internet access at this time is more critical than ever, as we require more people to go online, and we encourage them to go online for essential services. This initiative will allow students, families, and even young entrepreneurs to access online resources and keep in touch with friends and family. A number of partners contributed time, expertise, and materials to implement this project. Therefore, I must thank the global technology company Cisco for donating the technology infrastructure and the equipment for the public Wi-Fi hotspots, OffReg for coordinating the overall project, local IT provider Unified Technologies for the installation of all of the IT infrastructure, Flow and Cable and Wireless for the necessary bandwidth access, the Ministry of CPI, and a number of other government agencies and departments for providing the locations. The community Wi-Fi hotspots are at the following locations: the District Administration Building in Cayman Brac, the Government House in Little Cayman, and in Grand Cayman, the Georgetown Public Library, the James M. Bodden Senior Civic Center, the Northside Community Center, the Seafarers Association Hall, the South Sound Community Center, University College of the Cayman Islands, and the West Bay Public Library, and finally, the William Allen McLaughlin Civic Center in East End. Wi-Fi hotspots are accessible 24 hours a day and 7 days a week, and they are all, I am happy to report, well, they were prior to the outages recently, but they're all now live. We just got the UCCI hotspot live about 30 minutes ago. Members of the public are required to adhere to the relevant safety and social distancing guidelines when visiting these locations. Again, I want to thank all the partners who made this possible. I'll move on now to some of the departments under the ministry. The Cayman Islands Center of Business Development, we seem to have hit a milestone, continues to provide support for micro and small businesses across our islands. Last week, the Honorable Premier gave an update on the uptake of the government's relief measures for the micro and small businesses offered through the Cayman Islands Center of Business Development. But I want to update you that as of today, 749 applications have been received for the Micro and Small Businesses Grant Program. 83% of all applications received have so far been processed. The total value of the grant applications approved has hit $1,076,000 Cayman Islands dollars. Of this amount, $660,969.41 have already been received by the applicants. The remainder were approved and have been sent to Treasury for payment. The low-interest loan program received 60 applications, which represents about 37% of all the funds approved by Cabinet. And I'm happy to report today that 3 of these applications were recently approved by the Cayman Islands Development Bank. In addition to current services, once we can safely begin in-house services, the center will provide a residential business incubator where micro and small business owners can operate rent-free with business advisors on hand for financial and strategic guidance. And I'm certain that these services will be extremely useful for our micro and small businesses as we move forward. Continuing in the line of business, the Department of Commerce and Investment continues to provide exceptional service through their online platform and via remote work. Between March 21st and June 17th, over 2,900 trade and business licenses have been processed and issued. This includes over 600 new trade and business licenses, which I believe speaks to the confidence in our local economy and demonstrates that the entrepreneurial spirit is alive and well. I want to remind members of the public that in March, this government temporarily waived the trade and business licensing application fees for both new and renewals until the 31st of July. Late trade and business license fees have also been temporarily waived until the 31st of July. So there is still a window of opportunity for micro and small business owners in particular to benefit from these waivers. I also want to mention that all of the boards under DCI, Trade and Business Licensing, Liquor Licensing, Special Economic Zone, and the Film Commission are up and functioning. And so I want to thank the DCI team, and in particular the volunteer members of the various boards for their commitment and their response during the past few months. Moving on to the Department of Vehicle and Driver's Licensing, which again has become a good news story out of such challenging times. Over the past 3 months, staff have processed a total of 10,181 vehicle license renewals. Of this number, 7,873 vehicles, or about 132 vehicles per day, were renewed online. This is proof that the online system is safe and robust, and I'd like to encourage members of the public to continue utilizing this platform. DVDL will refine the online system to make it even more efficient and easy to use, with the hopes that customers will not have the need to return to the offices in numbers previously seen. There were 2,288 vehicles renewed over the counter for essential personnel and for the elderly during the same period. The total number of driver's licenses renewed during the period is 1,686. Again, I would encourage the public to use the online registered user portal. As we can see, it was quite successful during the period. The department is now finalizing procedures for the reopening of the written and driving test, and the public will be advised accordingly. In the meantime, if you have a learner's license that has expired, it can be renewed by completing the relevant form and emailing dvdl.helpdesk@gov.ky. And members of the public can also contact the DVDL at 945-8344 or via the email address, and I'll repeat it again, dvdl.helpdesk@gov.ky for information and queries. Let me now move on to the Department of Planning. As it relates to planning matters, the department has played a crucial role in the phased reopening of the construction sector. Planning personnel have provided in-field inspection services for those projects that had inspections pending, those prior to the shelter-in-place regulations, and they are now transitioning to multifamily and commercial projects as these projects have come back on stream. For the period March 15th to June 19th, again using online platforms, numbers of permits issued were 108 for a project value of over $44 million. Number of certificate of occupancies issued was 38, valued at over $59 million. Number of projects approved during the period was 38, valued at over $10 million. And the number of inspections completed, 663. I'm also pleased to report that the Department of Planning has now partnered with the Postal Service to allow customers to pay planning fees at the 3 post offices, Airport, Savannah, and West Bay. These locations are able to process cash and check transactions on behalf of the department. So I would like to say a tremendous thank you to the Postal Service for this partnership, which highlights the efforts being made by the Civil Service to improve service delivery options to the public. On the topic of infrastructure, the National Roads Authority began critical road works this month to take advantage of the reduction in the number of vehicles on the roads. NRA crews have already completed resurfacing on Shedden Road, Harbor Drive, and Crew Road. And in the coming weeks, they will begin resurfacing North Sound Road by Alista Towers and Elgin Avenue by the police station. In Bordentown, they will resurface Mans Road, Pease Bay, and sections of Breakers, and on West Bay Road, and sections of East End by the blowholes. Work is also underway for the widening of the Chrissy Tomlinson Roundabout and the Rex Crichton Boulevard, which will be completed by the end of July and should offer some relief from the eastern districts. In addition, work is set to begin on the Airport Connector Road in the coming weeks. This will connect the Esther Tibbetts Highway to Sparky Drive to alleviate the heavy traffic through the industrial park area and also ease congestion on to the Butterfield Roundabout. This is a critical piece of road work that we will rely on heavily and have in place prior to returning to the numbers we saw prior to COVID. On Wednesday of last week, I attended the National Roads Authority Board meeting via Zoom, and we reaffirmed our commitment to continue our focus on making our roads safer for all users by adopting the complete streets methodology wherever possible. However, if space does not allow us, we will follow the shared streets methodology by using signage and road markings to identify and remind users that the streets are to be shared by motorists, cyclists, and pedestrians alike. I'd like to encourage everyone to continue to be cautious and take our time whilst using the roads, keep an eye out for our teams doing the necessary upgrades. And just to say that a couple of weeks ago, we were restricted in our travel days and times, and we seem to have managed somehow. So let us continue to show the same levels of patience, plan our days to reduce our time on the road, and continue to share the roads with those of us who may be walking, jogging, or cycling to get around, or simply for some exercise. I have not touched on all the areas, but I wanted to highlight the importance of the work by the e-Government Services Unit, and particularly throughout this period. They provided support government they have provided support government-wide across agencies and departments. His Excellency the Governor spoke to some of those earlier. During the shelter in place, the e-government team have implemented a number of technology solutions across government. These include the COVID-19 self-assessment tool, the chatbot assistant for government coronavirus sites, and the distribution via text message of the ECID numbers for persons for driver's license, for persons whose driver's license were expiring to allow them to renew online with the registered user portal. The e-government team are currently working with the Computer Services Department and vendors for the launch of a number of e-commerce solutions in July. Some of these solutions include the online application for the Center for Business Development, which will allow for micro and small businesses to apply for the grants or loans online. The online system to facilitate the submission of items to be published in the Gazette. Additional online services for DVDLs, such as new vehicle registration and vehicle transfers. And the online system to support the submission of applications for British Overseas Territory citizens, naturalization, and registration and proof of nationality, as mentioned by His Excellency earlier. This COVID-19 pandemic has brought the importance of digital services and the digital economy to the forefront. While we have benefited significantly from the efforts to date with our existing online services, we have become more aware of major opportunities or gaps, whichever way you want to look at it, particularly in the digital sphere. A key one being the absence of a national identification system. The good news is that the e-government team have been working on this system and a few other projects. The team has made progress that will move the Cayman Islands forward significantly in the digital economy with the implementation of the population register and the national ID system. The team has been working towards the procurement of a comprehensive suite of services, equipment, software, and support in relation to the ID system. It is anticipated that this will allow for the issuance of national IDs starting in the second quarter of 2021. The key dependencies to achieve this is the completion of the population register, supporting legislation, and the procurement process. The population register is still on track for launch in the fourth quarter of this year, with the majority of the technical solutions currently implemented and ready. The population register is key to accurate identity information at the source, which will enable convenience. It will facilitate all CIG entities being able to check basic information at the source instead of requiring you to provide the information which CIG already holds. The information to which the entity is granted access will be dependent on the justified needs and kept to the minimum. Going forward, there will be services for residents to view their personal data, request updates on their personal data, view at a very high level who has accessed their personal data, and share access to specific elements of their personal data with specific parties for specific periods. Before I close, I want to thank the e-government and the Computer Services Department teams for all the work behind the scenes in supporting government to transition services online. Also, a big thank you to all the employees of the ministry for their dedication during this period. And in spite of the circumstances, we have been able to accomplish some major projects in assisting the country to continue its operation during the lockdown period. So that's my update for today. I thank you all very much. We will have I think there was a press release went out today with a map included for all of the Wi-Fi hotspots, and you'll be hearing a bit more from me later in the week about my Special Economic Advisory Committee. But that's all I have for you today. Thank you.
Thank you, Minister Hugh. Thank you to all our panellists. We have questions from members of the media. We'll start with the Compass. Kayla.
Hi. I wanted to start off with a question for the Minister of Health and possibly for Dr. Lee. Minister, you mentioned that the mosquitoes that we've seen as of late are not disease carrying. So, are these not the Aedes aegypti mosquitoes that we typically have? What kinds of mosquitoes then are we experiencing?
I don't want to go outside my borders and tell you what type of mosquito it is, but I can probably get that information for you before the press conference is finished.
Okay. And earlier this year we had concerns about dengue, and have not heard much since the COVID-19 caught all of our attention. Is dengue infection still a concern given the increased mosquito population we're having?
No concern. I haven't been given any updates on any dengue. Of course, we set our traps and check our traps every day, and we're flying constantly. I can also get an update specifically on dengue for you also.
Okay, that would be great. And you listed off different protocol for HSA, and one thing I wanted to touch on that a new parent reached out about is the protocol for C-sections, and whether or not the partner of the woman giving birth would be able to be in the room with her during a C-section. Is that something that is allowed?
Checking, I think I mentioned that information earlier. In the maternity ward, it's one visitor per day permitted.
Okay, and so that visitor would be able to presumably be the father during the C-section?
Whoever they chose.
Okay. All right.
Dr. Lee may have something to add to that.
Okay.
I'm not a mosquito expert at all. That would have to be the MRCU, but clearly at the moment we don't have problems with the Aedes aegypti or the albopictus, and those are the two mosquitoes that cause the vector-borne diseases normally. As you know, dengue is not endemic in the Cayman Islands, so it requires it to come here from somewhere else, and with our borders being closed, those mosquitoes are not able to board planes and get here. Or come in the other ways. That was a joke on my part. Or come in the other ways that they do, being brought in by travelers to other countries. As far as the visiting to, as far as having an accompaniment to C-section, there was a presentation yesterday on Cayman Compass radio show at around lunchtime where Ms. Lizette Yearwood, the CEO of the HSA, spoke to that matter. I understand they are revising their process to allow that. It's taken a change in view of the COVID restrictions, and that is now possible. She's texted me just a few moments ago.
Okay. All right. Thank you for that update. And I'm not sure if this is a Ministry of Commerce program, but there was the Tourism Assistance Program that was announced in previous weeks, and I just wanted to get an update on payouts for that and how that assistance program is going.
Kayla, I actually spoke to the Deputy Premier, who's the Minister for Tourism, and there were some concerns in terms of when the payments would be made, and the response I got earlier today was that they're being processed, and I hope to get them out the end of next week, the payments.
Okay. Wonderful. Thank you for that. Let's see what else. I know that parents have been very interested in getting the Ministry of Education on the panel to answer questions. And there had been some indication that with the audit report that came out that we might get the Minister of Education on the panel. Is that something that is still possible?
On Friday.
This Friday?
Yes.
Okay, wonderful. Thank you. Easy answer there. And I have one last question from restaurants. I have gotten some complaints from restaurant operators that it's quite variable how well different establishments are reinforcing social distancing protocol. Are we still having police visit restaurants to ensure that social distancing is taking place, or are they focusing their efforts elsewhere?
I presume the police are doing their usual checks. So there isn't a plan or a program in place for police to go around and enforce social distancing, if that's what you're asking.
Yeah, I just heard some concern from restaurants that patrons were indicating that they'd rather go to other places that were a bit more relaxed in their protocol rather than the places that are strictly enforcing. So there seems to be some maybe concerns in that sector about the application of the regulations.
Well, you know, people need to take some responsibility for their own welfare as well. I hope we don't get to the point where we have to have police measuring the distance between people at establishments. You know, there has to be, at this stage where there is a relaxation in the government restrictions generally, the adoption of some real responsible behavior among all of us, because it's in all our own welfare that we continue to practice safe conduct as we slowly escape from the threat of this virus. So I don't know what more we can do. We're damned if we do, damned if we don't. When we insist on going really hard at these issues, we get hammered. When we expect people to behave responsibly, we get hammered. So I'm not sure what we can do.
Of course. And Premier, while I have you, could you repeat the contact for the travel hotline that you, or travel service that you discussed earlier?
That doesn't come into effect until the 1st of July. The present protocols remain. I'm just announcing today that there will be a shift in responsibility. We're going to keep, as far as possible, we're going to keep all of the now well-known contacts the same to avoid confusion. So I don't think I actually mentioned a particular. No, I didn't mention a particular contact in this announcement, but as and when the transition is completed and begins activity on the 1st of July, there'll be adequate notice going if there are to be any changes. But we're going to try to keep contacts which people are now well familiar with the same.
Perfect. And my last questions are for Minister Hugh. Minister, we've seen that sargassum is returning to our shores, and the work program helped with some of that cleanup the last season. Is it possible that we will see another program implemented this year?
Yes, we once it is safe to do so, and we are back up and operating at capacity that we are able to manage and supervise the program, then we will reinstitute the NICE program.
But it sounds like we're not quite at a point with safety, public health, that the program could be launched soon.
Exactly. So we are continuing to get our teams back to work at full pace. We are trying to catch up in certain instances. And once we are there and it is also safe or manageable for our teams, because obviously with some of the restrictions required or conditions required, we will have to work in smaller groups. We will have to do training, orientation, et cetera, in smaller groups. So we are planning. We are in the planning stages of the program as we usually do, but we will have to wait until the conditions and the ability is there for us to carry it out.
Okay. And with the unemployment situation, do you anticipate expansion of the work program or the NICE program?
Yeah, I certainly do, and that again is one of the challenges that we will have to plan for. As you can imagine, each group that we put out to work, we will need to provide supervision. We'll need to provide transportation, tools, and PPE. And this is all going to take some time to put together.
Okay. Thank you for that. That's all for me.
Thank you, Kayla. I know we have some questions. April, Radio Cayman, go ahead.
Sorry, guys, I'm using a different device, so I had to find the button. Minister Hugh, two of these questions are really for you. It's just a little bit of a follow-up on the Wi-Fi initiative. I'm just curious how you actually feel about the initiative and where we are, and do you think it's enough to, I guess, close some of the gap on the digital divide that we've been seeing that was so evident during the lockdown period when the kids weren't in school?
I'm certainly very pleased with the program and the private sector that all stepped up in partnering with us in this program. It is something that we wanted to launch a bit earlier, but we didn't feel that a public Wi-Fi or a public hotspot would be manageable as far as social distancing and the public health safety matters. So we've resisted in doing so until now. But we also believe that it is even more important now as people are out trying to put their businesses back together. Perhaps some persons are seeing this not as a challenge, but as an opportunity and are planning to start new businesses. But I think now is an opportune time for persons to have access, and the entire 3 islands to have access to the internet and connectivity. I know that the the Ministry of Education and other private sector stakeholders are working on several other programs. We should be hearing about that in the near future to address some of the challenges we saw with homeschooling, in particular with the public schools. So I know there's a lot of effort going on. There's a lot of work being done in the background, and there are some fantastic initiatives that will be coming out over the next coming weeks.
Thank you very much, sir. And I'm not entirely sure who this question is for, and it may have been addressed previously, but a couple of our listeners asked for some clarification about the situation with nightclubs. They were just having trouble reconciling the idea of nightclubs in small groups and asked me if I could get some clarification on how that's going to be working here in the next phase or portions of the phase.
Nightclubs are not allowed to open.
Currently, they're asking in the future, will we be limiting access to them, having requirements on how that functions, or will we just keep them closed until that period changes?
Yeah, I don't see nightclubs being allowed to open before August, by which time we hope on the present trend we should be able to say it is safe for people to resume normal activity. So the restrictions with respect to numbers would fall away.
Thank you very much, sir. And this other question is, I think, for Dr. Lee, if he's still there. One of our listeners had been following matters internationally, and there was discussion of what they called excess deaths, which, as I understand it, are deaths that weren't necessarily directly linked to COVID-19, but may indicate that there were some undiagnosed COVID-19 disease deaths. And I just wondered if Dr. Lee could speak to that issue at all, whether we've seen anything of that sort here for our listener.
I think I raised that issue yesterday in a talk show at lunchtime that Cayman Compass hosted about the excess deaths. In that, if you look at the United Kingdom's figures, for example, they are reporting pretty much most of the deaths that they think are related to COVID disease, whereas other countries are not. But if you actually look at those countries' excess deaths, you will find that there's on the average basis, there is a huge jump when COVID started to be an issue in that country. So in the fullness of time, we'll actually get a much better picture, a much more accurate picture of the extent to which COVID has affected each country, even though at the moment people are reporting slightly different things. And with time, we'll be able to regularize those statistics. It doesn't mean that some countries are not in what I read was called an unhappy group, where they appear to have done less well than other countries. And the reasons for that, again, will probably become more apparent with time. As far as Cayman is concerned, our overall mortality rates are very small, so it's much more difficult to pick up this sort of thing. You need hundreds and thousands of something in order to pick up a trend. We will look back at it with time. I don't believe there has been any particular change, but it's very difficult if you have small numbers to, when you know, ones and twos, it's very difficult to know whether that's statistically significant or not.
Thank you very much. Those are my questions.
Thank you, April. We'll head to CNS. I know Wendy has some questions before we finish. Wendy, go ahead.
Thanks, Caroline. I have a couple of questions for Minister Hugh to begin with. Minister Hugh, can you tell us why those locations were picked for the hotspots? Because libraries already have internet access, and so do most of the civic centres. So I just wondered why we're kind of doubling up. I didn't think to pick maybe other areas where there isn't any internet access at all.
I don't know of most civic centers having Wi-Fi. I know one or two have been placed there, residential sort of Wi-Fi by the representatives. I know South Sound Community Center was being paid for by the representative for that area, Councillor Connolly. So what we have done is we've upgraded these locations. We have placed a Wi-Fi outside, so the entire area outside is a hotspot with much stronger, much more dependable connectivity. And these are, for obvious reasons, being civic centers, libraries, or centralized locations that are easy to find for residents.
Okay, thank you. The other question is the DVDL. As you said, a lot of things have been able to book a lot of things online, but there's quite a few things that people can't do, and there seems to be some difficulties getting hold of anyone at the DVDL on the phone, and readers are telling us that they're not responding to emails either about some of these more complicated services, like people buying new cars or other changes that they need to do. Are you able to say when you think more services are likely to come online, and in the interim, what people should do to get hold of somebody at DVDL?
Yeah, I did. I read out a email address earlier. That's dvdl.helpdesk@gov.ky. And also the phone number there is 945-8344. We are working towards, and we've been assisting persons, essential services, as well as the elderly and those who are unable to complete their transactions online. We will be opening the offices as soon as we feel that it is safe, both for our staff and for the customers, to start utilizing the counter services. And once we've put all of the necessary precautions and safety measures in place. We will keep you posted on that. I've asked them to try and complete the necessary upgrades for the PPE as soon as possible. And we will update you at that point. There are some very handy videos, at least one video I know, and other information on our Ministry of CPI website. And if you would like, actually, you can shoot one of us an email, and we'll be sure to send you as much of the videos and the other instructional leaflets that you can publicize on your publication.
Okay, great. Thank you. Appreciate that. My other questions are, I think, largely for the Premier. Mr. Premier, do you know anything yet about international mail?
About what? International what?
Mail.
Yeah, international mail, post, especially from the United States. We keep getting that coming up all the time. People saying that they can't get things from the US. They can't send things to the US.
Yeah.
Do we know anything about that?
And we keep responding in the same way. It is not the Cayman Islands that is responsible for that. It is the United States. So, because we're not in control of mail that comes here, the mail is brought here by U.S. planes. It doesn't come on Cayman Airways. In any event, but there are no regularly scheduled flights. So that is the problem. It's not the Cayman end of it.
Okay. Oh, no, that makes sense. Thank you for that. I appreciate it. The other question is, again, I asked this a while ago, but it's come back up again, and quite a few people have asked about it, which is the problem of workers who may have actually kept some salary, but a very small percentage of what they were earning before, especially those in tourism. And they're really struggling with insurance because in some cases, family health insurance policies are actually more expensive than what they're being paid. Are these people, should they be going to the needs assessment unit? That's effectively the question. Or is there some other way that they can be helped?
Yes, if they're Caymanian or permanent residents, yes, NAU is the place to go.
So regardless of what their circumstances are, even if they kept their job, they can still go there.
Well, the issue that NAU will have to determine, well, if they've kept their job, they should, because the employer has a duty to provide health insurance. If they've kept their job, they should have health insurance. Otherwise, their employer is in breach of the law. It would only be if they don't have a job.
There's two issues. One is some people have kept their job is furloughed, if you like, and they're hoping to give them their job back when tourism starts again. But in the meantime, they're being paid a very small percentage of their salary, and therefore they cannot afford to make up like the full package, especially if they have family policies. So if their employer's only paying a small amount of the insurance, do you understand what I mean? And their salary is not making up the rest of it. It's that seems to be the main issue.
Okay. Well, as I say, if they're Caymanian or permanent residents, that's a case they can make to NAU.
Okay.
Yes.
All right. I'll make sure that I put that out. And the last question is really about the situation with OFREG. It's like the second Auditor General's report now that has sort of criticised the agency and highlighted a lot of problems with it. Are you still satisfied that this is the right way forward for dealing with utilities, or do you think it's time to take a different look at it?
Well, it would certainly not be the time I would be turning my attention to that, Wendy. I'm afraid, as important as those issues are, there are many others that we're grappling with than to try to completely reinvent or rethink the approach to how we manage that sector. Obviously, government continues to have concerns about what's happening there or not happening there, as the case may be, and those things are not going to be allowed to slide. But your question about whether we should rethink the whole approach, now I don't think would be the time to do that, and not with all the other challenges that we have.
Okay, thank you very much for that.
Wendy, back to your other question. I've just been handed something from by the Health Minister, which is Health Insurance Premium Payment Assistance Program. They've actually put that in place, and the email address is hic@gov.ky.
Thank you. Appreciate that.
Okay.
Wendy, was that your last question?
Yeah, that's it. Thank you very much.
Thank you very much. Any closing thoughts from members of the panel?
I do have one more, completely forgot. Pension delays. Have I got time to just slip that one in? We've had a lot of people say that in some cases, they haven't even heard from the pension providers, never mind actually got their money. So they're all falling short of the law. Who should they go to complain about that?
The Department of Labor and Pensions.
Okay.
You had the boss on here, so complaints should be lodged there. But I should say generally, it is working. The program is working very, very well. Obviously, there have been major issues with fidelity. Those been made very public, but otherwise things seem to be going quite well.
Okay. Thank you.
Thank you very much. Thank you to our panel. Thank you very much to you viewers for tuning in. We'll see you again tomorrow afternoon. Remember to check out gov.ky/coronavirus and all our social media channels for the latest information. In the meantime, stay tuned for the latest regional and international coronavirus statistics.